study by the Business Roundtable. That's made up of all these big companies out there. They're not partisan, but it's not like they're just dyed-in-the-wool liberal Democrats, let's put it that way. These are company CEOs. They commissioned a study and said the reforms could reduce premiums by as much as $3,000 per employee. That's their study, not mine. Then the Congressional Budget Office said that the government would save $1 trillion. Reduce the deficit by $1 trillion. So think about it. You're saving money, employers are saving money, the federal government is saving money. Not according to me, but according to these studies that were done by independent analysts. So here's the bottom line, St. Charles. There's no government takeover, unless you consider reining in insurance companies a government takeover. And I think that's the right thing to do. There's no cutting of Medicare benefits. They're just cutting out fraud and waste in Medicare to make it stronger. What we're proposing is a common sense approach to protecting you from insurance company abuses and saving you money. That's the proposal, and it is paid for. And I believe that Congress owes the American people a final up or down vote on health care. The time for talk is over. It's time to vote. They like to talk. So Washington's doing right now what Washington does. They're speculating breathlessly, day or night. Every columnist, every pundit, every talking head. Is this proposal going to help the Republicans, or is this proposal going to help the Democrats? What's going to happen to the president's polls numbers? If the vote doesn't go forward, if it does go forward, what will it mean for November? What will it mean for 2012? How's the politics going to play? I heard the Republican leader of the Senate the other day. He's warning Democrats. You better be careful about voting for this. It could hurt you. I don't know how sincere the Republican leader is about the best interests of Democrats. He's been very generous with advice. You know what? Here's the bottom line, St. Charles. I don't know how the politics play. I don't know. This is a hard issue. It's a complicated issue. There's a lot of information floating around out there. A lot of it's inaccurate. The opponents have spent millions of dollars fighting. And people during recessionary times, they're anxious and sort of thinking, gosh, can we really afford to change things right now? Maybe we should just kind of stick with the status quo, even though we know it's not working for us. So I don't know how the politics plays. But here's what I do know. The American people will be more secure with this reform. Our country will be stronger because of this reform. I don't know about the politics, but I know it is the right thing to do. And that's why I'm fighting so hard to get it done. We've seen years, decades, where Washington just puts up dealing with our toughest challenges because it's too hard, because we don't know how the politics works. And the will and the capacity to act, to do serious things in this country, starts just getting sucked away. Just gets sapped by partisanship and political gamesmanship and debates about who's up and who's down. How does this play politically? instead of asking what's right and what's wrong. We've seen terrible consequences. Not just these last 2 years of turmoil, but a decade of struggle for middle-class families. We can't accept the status quo. We can't accept the same old, same old. I won't accept it. Claire McCaskill won't accept it. Not when it comes to how we manage taxpayer dollars. Not when it comes to how our healthcare system works. Not when it comes to meeting the difficult challenges that we face. And that's why Claire and I are fighting to stop waste and abuse in our government. That's why Claire and I are fighting to pass these health insurance reforms.